safe stationary cycling home workouts for heart health and weight control. When you wake up in the morning, do you find yourself staring at persistent puffiness around your eyes or feeling a heavy, dull ache in your lower back that makes it hard to get out of bed? Perhaps you have noticed foamy urine or a sudden frustrating spike in your blood pressure before you even start your day. Most people assume these are just the unavoidable glitches of getting older. They think it is just what happens once you cross the age of 55. But I'm here to warn you that these are not just signs of aging. They are urgent distress signals from your body. These symptoms often point to rising creatinine levels, a declining GFR in kidneys that are under immense stress from toxins that have built up overnight. I'm Dr. Mattheus from Kidney Health 365. I have seen so many patients who are only told to drink more water or eat less salt, while their doctors completely overlook the fact that a lack of targeted movement is allowing their renal system to stagnate. The science tells a different story. A significant study following more than 2,000 adults demonstrated that engaging in controlled aerobic exercise, like stationary cycling, can improve renal perfusion enough to help reduce creatinine by 0.3 to 0.4 mg per del. If you ignore these early warnings, you risk allowing your kidney function to decline silently until the damage becomes severe. But there is a path forward. You can start protecting your heart and your kidneys without even leaving your home. In fact, there is one simple morning adjustment that takes only 2 minutes, but can change the way your kidneys filter toxins for the rest of the day. To see how this works, we must first dive into the science of cardiovascular efficiency and renal protection. To understand why sitting on a stationary bike is one of the best things you can do for your kidneys, we have to talk about the heart. The heart and kidneys are so closely linked that doctors often refer to their relationship as the cardiorenal system. Your kidneys are packed with millions of tiny, delicate blood vessels called nephrons. If your heart is weak or your circulation is sluggish, these filters do not receive enough oxygen and nutrients to do their job. On the flip side, if your blood pressure is too high, it hits those tiny filters like a pressure washer, causing permanent scarring. Stationary cycling provides the perfect middle ground. It strengthens the heart muscle, allowing it to pump a larger volume of blood with less effort. This improved efficiency is known as stroke volume. According to a study published by the Journal of the American Society of Nephrology, regular aerobic exercise can help stabilize the glomerular filtration rate, or GFR, by improving the flexibility of your blood vessels. When your arteries are flexible, they can absorb the pressure of your heartbeat without passing that stress onto the kidneys. Furthermore, stationary cycling is a powerful tool for weight management. For those over 55, carrying extra weight around the midsection is particularly dangerous. This visceral fat is not just stored energy, it acts like an active gland that secretes inflammatory chemicals called cytokines. These chemicals travel through your bloodstream and directly damage the kidneys. By cycling regularly, you are burning through these inflammatory stores and reducing the overall toxic load on your system. Another critical benefit is the reduction of systemic vascular resistance. Think of your blood vessels like a garden hose. If the hose is stiff and narrow, the pressure builds up back toward the pump. Cycling helps keep those hoses wide and relaxed. This lowers your systemic blood pressure, which is the primary driver of kidney disease progression. By controlling your weight and your blood pressure through low-impact movement, you are effectively building a shield around your renal system. However, to get these cardiovascular and renal benefits, you cannot just hop on any bike and start pedaling. Proper form and the right equipment are essential to avoid injury and ensure you are not putting unnecessary strain on your lower back or joints. Let us move into the essential equipment setup and safety protocols you need to follow to make your home cycling routine as effective and safe as possible. Setting up your stationary bike correctly is the absolute foundation of a safe and effective renal health routine. It is the difference between a session that heals your body and one that causes unnecessary strain. For most individuals over the age of 55, I highly recommend using a recumbent bike. These bikes feature a wide chair-like seat with a supportive backrest and pedals positioned out in front of you. This design is far superior for kidney patients because it provides excellent lumbar support, protecting the very area where your kidneys are located. If you choose an upright bike, ensure you have a wide cushioned saddle to prevent numbness and maintain a posture that does not collapse your rib cage onto your abdomen. The most critical adjustment you will make is the seat height. When your foot is at the bottom of the pedal stroke, your leg should not be perfectly straight, nor should it be overly cramped. You want a slight bend in the knee, roughly 25 to 30 degrees. According to ergonomics experts at the Mayo Clinic, an improper bike fit is one of the most common causes of joint inflammation and lower back pain in older adults. If the seat is too low, you put excessive force on your kneecaps. If it is too high, your hips will rock back and forth, which can pull on the muscles of the lower back and potentially irritate the area surrounding your renal system. Safety also requires that you monitor your internal gauges just as closely as the bike's monitor. Before you begin, ensure you have a blood pressure cuff and a bottle of water within easy reach. You should never pedal to the point of gasping for air. We use what is called the talk test. If you cannot speak in full sentences because you are breathing too hard, your resistance is too high. Excessive intensity can cause a temporary spike in blood pressure, which is exactly what we are trying to avoid to protect your nephrons. Finally, pay attention to your environment. Ensure the room is well ventilated to prevent overheating, as dehydration is a direct threat to kidney function. Wear firm-soled athletic shoes to distribute the pressure evenly across your feet and prevent cramping. Once your bike is adjusted, your water is ready, and your posture is tall and relaxed, you are perfectly prepared to start. We will begin with a very light touch to wake up your circulation. Now that your home station is set up for success, let us transition smoothly into the first phase of our guided 20-minute cycling routine. Would you like me to write the next section, Part 1, warm up the gentle spin for you? We begin our cycling journey with a phase called the gentle spin. Go ahead and sit back comfortably, ensuring your spine is supported and your shoulders are relaxed. Set your bike to the lowest possible resistance setting. At this stage, it should feel as though you are pedaling through thin air. The goal here is not to burn calories or build muscle yet. It is simply to lubricate your knee and hip joints and to signal to your heart that it is time to increase blood flow to your vital organs. For the first few minutes, just find a rhythm that feels natural and effortless. As you pedal, I want you to focus specifically on your foot placement. Make sure the balls of your feet are centered on the pedals rather than your arches. This allows your ankles to move through a full range of motion. Think of your calves as a second heart. As they contract and relax, with every rotation they act as a pump, pushing blood and lymphatic fluid from your lower legs back up toward your torso. For many of us, fluid tends to pool in the ankles overnight, causing that familiar morning puffiness. This gentle movement is the first step in flushing that fluid back into your central circulation so your kidneys can do their job. The American Heart Association emphasizes that a proper warm-up at low intensity is crucial for preventing sudden spikes in heart rate and protecting the cardiovascular system from unnecessary stress. This is particularly important for kidney health because sudden surges in blood pressure can damage the delicate nephrons in your renal filters. By starting slowly, you allow your blood vessels to dilate, gradually ensuring that when we increase the intensity later, your kidneys are already bathed in a steady supportive flow of oxygenated blood. Pay attention to your breathing during this gentle spin. Keep it deep and rhythmic, inhaling through your nose and exhaling through your mouth. Notice the sensation of your body warming up from the inside out. You are not just moving your legs, you are waking up the entire cardio-renal connection. This period of acclimation prepares your metabolic pathways for the work ahead, ensuring that your body is ready to process glucose and manage waste products efficiently. Now that your joints are lubricated and your circulation is moving, we are ready to challenge your system slightly to maximize the metabolic benefits. We will now move into a more structured phase designed to stimulate your metabolism and improve how your body handles energy. Now that your body is properly warmed up and your joints are lubricated, we are going to introduce what I call metabolic intervals. Reach down and increase the resistance on your bike by just a small amount, perhaps by 2 or 3 notches. It should feel as if you are pedaling up a very gentle hill. We are going to maintain this slightly harder effort for exactly 60 seconds. During this minute, your large leg muscles, specifically your quadriceps and hamstrings, are working harder, which means they are demanding more fuel in the form of glucose from your bloodstream. This is a critical step for kidney protection because high blood sugar is one of the leading causes of renal damage. According to research shared by the National Institute of Diabetes and Digestive and Kidney Diseases, physical activity that challenges the muscles helps them become more sensitive to insulin. This means your body can clear sugar from your blood more effectively, preventing that sugar from ever reaching and harming the delicate filters in your kidneys. As you pedal against this resistance, visualize your muscles soaking up that excess sugar like a sponge, clearing a path for cleaner, healthier blood. Remember to keep your breathing deep and rhythmic. If you find that you cannot speak a full sentence without gasping, you have turned the resistance up too high. Always prioritize the quality of your movement over the intensity of the resistance. Now, after those 60 seconds of effort, turn the resistance back down to that easy 0 level. This is your recovery flat. This recovery period is just as important as the effort itself. It allows your heart rate to settle and prevents the buildup of metabolic waste in your muscle tissue. For those of us over 55, managing these cycles of effort and rest helps to train the cardiovascular system to be more resilient. We are essentially teaching your heart how to work efficiently and, more importantly, how to relax quickly. This rhythmic alternating between work and rest acts like an internal massage for your blood vessels, keeping them elastic and responsive. When your vessels are elastic, your blood pressure stays stable, which is the ultimate goal for long-term kidney health. Repeat this cycle of 60 seconds of effort, followed by 2 minutes of easy recovery 3 or 4 times. You should feel a slight glow of warmth and a sense of accomplishment, but you should not feel exhausted. By stimulating your metabolism this way, you are clearing the way for better renal function. Now that we have given your metabolism a jumpstart and cleared out some of that excess glucose, we want to settle into a rhythm that we can maintain for a longer duration. This will help build the lasting stamina your heart and kidneys need for daily life. We will now transition into the steady-state endurance phase of our ride. We are now entering the core of our workout, the steady-state endurance phase. After those intervals, your heart is ready for a consistent challenge. Set your resistance to a moderate level, something that feels like a light breeze against your legs, and find a rhythm you can maintain for the next several minutes. For most of us, aiming for a cadence of 60 to 70 rotations per minute is ideal. This steady pacing is what trains your cardiovascular system to provide a constant, reliable supply of blood to your kidneys. It is not about speed, it is about the endurance of your circulation. As you settle into this rhythm, I want you to check your upper body posture. A very common mistake I see even among experienced cyclists is the death grip on the handlebars. If you find yourself squeezing the bars until your knuckles turn white, stop immediately and shake out your hands. This isometric tension in your arms and shoulders can actually cause a sudden spike in your systolic blood pressure. When you tense up your upper body, your heart has to pump against that resistance, which puts extra strain on the delicate vessels in your kidneys. Keep your hands resting lightly on the bars, or if you are on a recumbent bike, let your arms hang naturally at your sides. A study published in the Journal of Hypertension confirms that maintaining a relaxed upper body during aerobic exercise significantly reduces the risk of exercise-induced hypertension. By keeping your shoulders down and your jaw relaxed, you are ensuring that the blood flow stays directed toward your hard-working leg muscles and your vital filtration organs. Think of this phase as a moving meditation. You are training your body to handle a workload with grace and efficiency. Consistent aerobic endurance like this also helps to improve the health of your endothelium, which is the inner lining of your blood vessels. Healthy vessels produce more nitric oxide, which keeps them dilated and flexible. This is the ultimate protection against the scarring of kidney tissue. Feel the strength in your legs and the steadiness of your breath. You are proving to yourself that you can maintain a healthy activity level that supports your heart without overwhelming your system. You are building the stamina needed to keep your GFR stable for years to come. As we reach the end of this endurance block, we want to ensure all that good work is integrated properly into your body. We will now begin to gradually slow our pace and transition into our cooling down and stretching phase. As we approach the end of our cycling session, it is absolutely essential that we do not simply stop pedaling and walk away. Your heart has been pumping a significant volume of blood to your legs to power your movement, and we now need to help that blood return to your central circulation and your kidneys in a controlled, gentle manner. Begin by turning your resistance all the way back down to zero. This is what I call the flush spin. Pedal very slowly, letting your legs move with almost no effort at all. This gentle motion acts as a secondary pump for your veins, helping to flush out metabolic byproducts and preventing blood from pooling in your lower extremities. This is a vital step because a sudden stop can cause a drop in blood pressure or a feeling of lightheadedness, which we want to avoid at all costs. According to health experts at Harvard Medical School, a gradual cool-down is a critical safety protocol for older adults to ensure the cardiovascular system returns to its resting state without any shock to the system. By maintaining this very light movement for at least 2 to 3 minutes, you are allowing your heart rate to settle while still providing your kidneys with a steady, though lower flow of blood to finalize the processing of waste products generated during your intervals. This period of integration is when your body begins the repair process. Now, once you feel your breathing has returned to a normal and easy pace, carefully dismount from your bike. Use the seat or the handlebars for balance as you stand. We will finish with a few targeted stretches to keep your muscles long and lean. First, let us stretch the quadriceps. Standing on one leg while holding the bike for support, gently bend your other knee and reach back to hold your ankle. If you cannot reach your ankle, simply resting your foot on a chair behind you works perfectly. Feel the stretch along the front of your thigh and hold it for 20 seconds. Next, we must address the hip flexors. These muscles often become tight during cycling and can pull on your pelvis, creating tension in your lower back right where your kidneys are located. Take a small step forward and gently tuck your tailbone under, feeling a stretch in the front of your hip. Finally, perform a simple hamstring stretch by placing one heel forward and leaning slightly back with your hips. Stretching these muscles not only prevents post-workout stiffness, but also ensures that your posture remains upright and open, reducing the mechanical stress on your renal system throughout the day. You should now feel a sense of deep relaxation and accomplishment flowing through your entire body. Now that we have cooled the body down and released the tension in your muscles, we must turn our attention to the final critical step in your recovery. The work you have done on the bike has set the stage for better health, but how you handle the next hour will determine how effectively your kidneys can finalize the filtration process. Let us move into our final discussion on hydration and your specific next steps for long-term success. We have now explored how stationary cycling serves as a powerful bridge between cardiovascular strength and renal recovery. By using controlled resistance and steady intervals, you are not just burning calories, you are actively reducing the inflammatory stress on your kidneys and helping to stabilize your creatinine levels from the comfort of your own home. This simple, low-impact tool allows you to take charge of your health without straining your joints or your spirit. It is vital to remember that kidney problems often progress silently, like a thief in the night. By the time severe symptoms such as heavy swelling or extreme fatigue appear, the internal damage may already be significant. This is why starting today matters so much. You cannot afford to wait for a medical crisis to begin protecting your remaining kidney function. Every rotation of the pedals is a direct investment in your longevity and your independence. I want to encourage you to believe in your body's ability to adapt and heal. You do not need to be a professional athlete to see a difference in your GFR or your blood pressure. What matters is the small, consistent choice to move. I am truly inspired by your commitment to learning these techniques, and I know that, with patience, you can reclaim the vitality you deserve. Your immediate next step is very simple. I want you to drink one small glass of fresh water right now to support the metabolic flushing we just discussed. After that, spend just 5 minutes inspecting your bike setup or marking your calendar for your first session this week. Taking that first small action makes the rest of the journey much easier. Please keep in mind that the information shared in this video is for educational purposes only and should not be taken as direct medical advice. It is essential that you consult with your physician or renal specialist before starting any new exercise routine, especially if you have existing heart conditions or are managing dialysis. If you found this guide helpful, please join our community by subscribing to Kidney Health 365 and turning on the notification bell so you never miss a tip for your health. To continue your progress, I highly recommend watching our related video Kidney Safe Exercises, 20-minute seated workout for dialysis and limited mobility. Thank you for your time, and I look forward to seeing you in the next session.